Hello guys, girls, welcome to my channel. Today we are speaking the symptoms. My stool is bloody. What should I do? And with you Begum Talab Qaza. Okay, stool with blood can occur in several diseases of the gastrointestinal tract. Nose, stomach and intestines, right department ulcer in the last part of the intestine, red blood, bowel cancer, hemorrhoids disease, anal fissure, and the other disease. I don't have money. Can I have a free consultation? Yes, it is possible, but only if the blood comes out a little. To do this, you will make an appointment with a therapist or general practitioner at the clinic at your place of residence. Or if you have in polyclinic physician doctor, make an appointment with your physician doctor. Then, these doctors refer you to a surgeon or a proctologist. And if there is a large amount of blood or accompanied by dizziness, abdominal pain, urgently call 103 in Kazakhstan. If you living in USA, call 911. An ambulance. If you don't want to wait, go to the emergency room. Okay, I don't have time. I want to do a quick check. What should I do? Contact private clinics and make an appointment with a surgeon, proctologist, doctors. Okay, what do you do? To find out the exact reason, you should see a surgeon proctologist. He examines the rectum with a finger and, if necessary, prescribes an endoscopy. This is finger examination in the rectum. This time doctors palpation your rectum if you're feeling a tumor, and also giving advice next steps. Okay, what is mean finger examination of the rectum? Digital rectal examination is a mandatory method of diagnosis of disease of the rectum, small intestine and the organs of the abdominal cavity. Indications for digital rectal examination: lamentation of pain in life, organ dysfunction is poor, bowel dysfunction, prophylactic examination for the purpose of early detection of rectal pathology. Okay, next, rectal examination makes. Digital rectal examination makes it possible to assess the functional state of the muscles of the anus, to identify disease, pathological change in the anal canal and rectum, fissures, fistulas, hemorrhoids, cicatricial changes, and the narrowing of the intestinal lumen, benign and malignant neoplasm, foreign bodies, inflammatory infiltrates, cystic and tumor formation of pararectal tissues, sacrum and coccyx, change in the prostate gland in men and the internal genital organs in women, state of the pelvic peritoneum, rectouterine or rectovesical depression. What is an endoscopy? Endoscopy is a simple medical procedure that helps the doctor detect abnormalities in the gastrointestinal tract, especially the anus and rectum. To perform an endoscopy, the doctor inserts a device called an endoscopy in the anus. This area is usually made of plastic, disposable or stainless steel. Disposable endoscope allows the doctor to examine the tissues in the anal rectal areas in detail. Endoscopy can detect several conditions and diseases that can affect the lower part of the intestine. This includes cancer, tissue tears, occulent anal fissures, hemorrhoids, swelling veins around the anus and or rectum, and rectal polyp. Next, and after if you doctor thinking you need exam colonoscopy, you go colonoscopy. What is mean colonoscopy? It is now that a complex procedure such as a colonoscopy is necessary to diagnose the pathology of the colon and rectum. The procedure consists of inserting a probe colonoscope into the back hole. The probe is attached to a flexible tube and consists of a small video camera which allows the doctor to examine the entire mucosa of the intestine. The length of the device is up to 1.45 meters, which allows examination of the cecum, sigmoid, margin, and rectum. Colonoscopy does not affect the small intestine. If necessary, a colonoscopy can remove polyps or other types of tumor or take tissue samples for analysis. Biopsy. Anal fissure. An anal fissure is a linear defect of the mucous membrane of the anal canal, which occurs as a result of its overstretching during the passage of a fecal lump. Altered defect causes sphincter spasm and acute pain. This is a common proctological disease occurring in 20-25 cases per 1,000 population. Its specific weight in the structure of colon disease is 15%. The reasons why my stool is bloody. The cause of the appearance of anal fissures is mechanical overstretching or overtension of the anal sphincter. Such a situation may arise in the following cases. First, prolonged constipation, multiply diarrhea, the need to strain hard during defecation, efforts during childbirth, anal sexual contact. Okay, and the reason, in addition to mechanical factors, anal fissures can be accompanied by inflammatory disease affecting the anus. Trauma and previous operation also increase the risk of anal fissures. Symptoms of anal fissures development. First, pain during active defecation. Second, insignificant bleeding in the form of streaks on fecal masses or paper, and anal itching. What is hemorrhoids disease? Hemorrhoids as the most common proctological disease. Hemorrhoids affect an average of 14 people out of 100, and its share among disease of the rectum is about 40%. Moreover, men get sick 3 times more often than women. Okay, and in this picture we are looking hemorrhoids. Hemorrhoids, we have 2 types. This is internal hemorrhoids because he is standing in the rectum, and also we have external hemorrhoids disease. Next, hemorrhoids are nothing more than varicose vein of the anal canal and rectum forming cavernous formations, so-called hemorrhoids. Experts distinguish 2 types of hemorrhoids, external and internal, depending on the location in the anal canal. External hemorrhoids form in the immediate vicinity of the anus. Internal hemorrhoids form at the point where the anal canal passes into the rectum. Okay, this picture we are looking prolapsing internal hemorrhoids. This is external hemorrhoids. This is internal. Okay, and also we have perianal vessels. Internal hemorrhoids. If this hemorrhoid is standing this place, we are saying internal hemorrhoids disease. Common symptoms of hemorrhoids. First, rectal bleeding, anal pain, anal and rectal itching, feeling of rectal fullness, soiling of underwear, bulging tissue from the rectum, difficulty cleaning after a bowel movement. 4 reasons why hemorrhoids appear during pregnancy. The enlarged uterus will compress the blood vessels in the abdomen, causing the vessels to have difficulties in carrying blood back to the heart. Second, hormones during pregnancy contribute to the enlargement of blood vessels, which results in further congestion of blood. So, constipation that occurs during pregnancy is one of the contributing factors of hemorrhoids as well. Standing or sitting for a long period of time can also trigger hemorrhoids disease. Benign and malignant neoplasm of the rectum. Okay. Tumors of the large intestine are benign or malignant neoplasms of various etiologies that develop from the epithelial or other tissues of the walls of the large intestine and can affect any of its departments. Benign tumors are quite common according to various sources. They are detected in 16-14% of the population. In many cases, a benign process eventually becomes malignant. Cancer tumors of the large intestine rank third among all the malignant pathologies of the digestive system after stomach cancer and tumors of the esophagus. And as this picture we are looking, this is stage tumors. Okay, you look, we have 5 stage. This is 0, first, second, third, fourth. And more time if your patient have stage 4 and this disease metastasis for all the organs. Benign and malignant neoplasm of the rectum. Among all oncopathology, malignant tumors of the large intestine are second only to lung cancer. Cancerous neoplasm in the stomach and breast cancer in frequency. In men, disease of this group, especially malignant ones, are detected somewhat more often than in women. The relevance of colon tumors is increasing every year, mainly in the developed countries of the northern hemisphere. Benign processes are just as dangerous as malignant ones because they tend to malignancy. Causes of tumors of the large intestine. The causes that lead to the occurrence of colon tumors have been studied for a long time, but scientists and clinicians, proctologists, surgeons have not come to a consensus. Everyone agrees that this group of disease is polyetiological. The risk of the developing pathology increases with age. Causes of tumors of the large intestine. Of great importance is diet rich in animal proteins, fat, and poor in fiber. Such a diet leads to frequent constipation and imbalance in the intestinal flora. The contents of the intestine with a high content of bile acids and phenols, which have carcinogenic properties, are in contact with the walls for a longer time, which increases the possibility of developing colon tumors. It is with that the greater spread of colon tumors in developed countries is associated carcinogens, which are contained in industrial preservative smoked products, are also important. Symptoms of colon tumors. Cancer tumors of the large intestine develop quite slowly and may not be clinically manifested at the very beginning. One of the first symptoms of the disease is bleeding and anemia. With tumors of a rectum and lower sigmoid colon, scarlet blood does not mix with mucus. If the pathological process affects the initial colon, the blood is dark, eventually mixed with mucus and feces. Bleeding during a malignant process in the proximal section is very often hidden and manifests itself only with anemia. Okay, we are completed. Goodbye. I love you.